Good morning, Mr. Stagg. My name is Curtis Gundrum. I am a student pharmacist working with the heart failure team and Dr. Pitcock. I'd like to thank you for coming in this morning. I just want to talk to you a little bit about your heart condition, as well as go over a few lifestyle changes I think we can implement, and I'd like to go over the new medication we're going to have you taking. Now, while I'm going over this, please, if you have any questions, don't hesitate to ask, and I'll answer them for you, okay? So first off, I just want to explain what your condition is if you don't already know. You have heart failure with reduced ejection fraction. Basically what that means is your heart muscle is weaker than normal and it's not pumping enough blood to your body. So your ejection fraction is about 30% and it should be about 50%. Basically what that means is when your blood goes into your heart, it's going to push out blood every second, and that percentage is how much it pushes out. So yours is a little lower than normal, so we need to fix that. But with some lifestyle changes, we can decrease the risk of anything worse happening. And this also doesn't mean that your heart is completely stopped either. Again, it just means that it's not working as efficiently as normal. So some lifestyle changes I'd like to go over with you. I've got a few here. So the first one I'd like to go over is your salt intake. So if you didn't know this already, salt basically makes you retain more liquid. Whenever you take in salt, the water is going to retain in your body, causing swelling, and this will lead to shortness of breath. And I know you said you don't want to have any bland food, so I can get you a list of different spices or food recipes that don't include salt in them, and we can get you started on that right away. Another thing I'd like to talk to you about is your fluid intake. I see you've been drinking about 2 liters a day now. That's a pretty good amount. Usually for heart failure patients, we'd like to keep them at 2 liters a day minimum, and that includes all liquids. So when you're drinking, I'd like you to monitor and make sure you're only drinking about 2 liters of liquid a day, no matter what it is, okay? Next is your caffeine intake. I see that you're taking about 1 to 2 cups of coffee every day and 2 to 3 cups of sodas. As long as that doesn't impact your sleep schedule and it's not causing you any heart palpitations or any unnormal heart conditions, I'd say you're fine with keeping on that normal schedule. But just make sure you drink in moderation as you're doing right now. Just don't overdo it. And again, keep in mind, we're going to have you on 2 liters every day. Now, we're going to take a look at your alcohol. It looks like you're drinking every night. We don't really like heart failure patients drinking alcohol because this can weaken the heart. So I'm going to ask you if you could try your best. Could you try to maybe turn it down to like once every other day? Because we kind of want to get you off that. We want to make sure your heart's as healthy as possible. And then I also see that you are a user of marijuana. Now, we don't have a ton of studies on this in heart failure, but it can interact with some of the drugs that you're taking. So I'd like to try to lean you off that and just take you off that so it's not interfering with any of the other drugs. But one last thing, a good thing actually, you are exercising a good amount. So you're taking those 20-minute walks. That is great. I want you to keep that up and only stop if you're just feeling unusually weird after your walk, like you have dizziness, chest pain, anything like that. Now, I want you to keep weighing yourself and make sure you're not gaining like 5 pounds in a week, because that could indicate that you are retaining fluids or you're drinking a bit too much liquid, over 20 liters every day. Now, the main thing I want to go over you with is your medication changes. The main one we're going to talk about is your lisinopril, the 40 milligram tablet. So we're not going to have you take that anymore. It's done. We're not going to go anywhere with that. basically, it was working fine for you, but we found something that I think will work a little bit better. So we're going to start you on this medication called Entresto. It's going to be a 49 to 51 milligram tablet, and you're going to take it 2 times a day, okay? So this is a combination between 2 medications. Basically, it's going to do the same thing as lisinopril, just slightly better, and it's also going to reduce any extra fluid in your body and decrease stress hormones. So, and when you take this is just going to reduce the risk of your heart failure getting any worse, and it's going to reduce the chance of you ending up in the hospital. So, yeah, we're going to be changing you from lisinopril to Entresto. And some important things to note about Entresto is that you're going to take it about 12 hours apart, once in the morning, once in the evening, and you can take this with or without a meal, so you don't have to worry about that. But some common side effects that we have seen when patients take Entresto are dizziness, and you might want to make sure you get up slowly whenever you do get out of bed, because that could lead to you falling down, and we don't want that. We've also seen patients develop a cough sometimes, so if you start developing a cough, that will be a side effect of Entresto. And very rarely we have seen swelling of the lips and tongue, but again, if this happens, please call us, because this is a more rare side effect. So we're going to be monitoring your blood pressure and your kidney function as well in our lab work. But as for the rest of your medications, we're going to keep you on a normal schedule for those. So your Farxiga, 10 milligrams, you're going to be taking that daily again. Your spironolactone, your 25 milligram tablet, you're going to be taking that daily as well. Your furosemide, 20 milligrams, you're going to be taking that daily as well. And lastly, your carvedilol, 25 milligrams, you're going to be taking that twice a day, just like normal. So the only one you're taking out is your lisinopril, and you're replacing that with the 2 times daily Entresto, okay? And yeah, that's kind of what we wanted to go over with you today. Again, you're stopping lisinopril, so no more taking that. Do not take that at the same time as Entresto. Please don't. So we're doing that, and we're implementing those lifestyle habits I talked with you about, mainly trying to decrease the amount of marijuana you take in, try to reduce the amount of alcohol you're taking, and keep your liquids to 2 liters a day, okay? And then keep up the running. That's kind of all I've got for you right now, but do you have any questions for me? All right, great. Well, thank you for coming in, Mr. Stagg. We'll check on you the next time you come in to visit, okay? And hopefully we'll be able to keep your heart in good condition and keep you out of the hospital. We'll see you next time.